Last year, I sat across from a 67-year-old man in my office. His chart read like a warning label. 4 blood pressure medications. 4. And his pressure was still dangerously high. He was not lazy. He was not ignoring his health. He was doing everything his doctors told him to do. And yet, nothing was working. But here is what nobody had told him. And what I am going to tell you right now, the answer was sitting in his kitchen the entire time. 5 simple things. No new prescriptions, no side effects, just food working the way food was always meant to work. Stay with me, because by the end of this video, you are going to know exactly what to do. Starting tonight, let me tell you something they do not always explain at the doctor's office. After 60, your blood pressure does not just go up because of stress or salt. Something deeper is happening inside your arteries. Think of your blood vessels like a garden hose. When you are young, that hose is flexible. It stretches. It absorbs pressure. It handles the flow. But as you age, the walls of those vessels start to stiffen. They lose their elasticity. And a rigid hose cannot handle the same pressure a flexible one can. That is when things start to go wrong. I am Dr. Lisa. I have spent 30 years in internal medicine and geriatric health. I have seen thousands of patients over 60 struggling with the exact same problem. And every single time I ask myself the same question, how did it get this far? The answer more often than not is inflammation. Chronic, silent, slow-burning inflammation in the walls of the blood vessels. You do not feel it. There is no obvious symptom. But day after day, year after year, it quietly stiffens and narrows those vessels. And your heart has to work harder and harder just to push blood through. So why does food matter so much? Because what you eat 3 times a day is either fighting that inflammation or feeding it. Every meal is a decision your body makes about your blood pressure. Most people do not realize that. Their doctors do not always have time to explain it. That is what this video is about, not replacing your medication. I want to be very clear about that, but giving your body 5 powerful tools that work alongside whatever your doctor has prescribed. Tools that in many cases I have seen make a dramatic difference, sometimes within days. Are you ready? Let us start. Here is a question for you. When you sit down for dinner tonight, what do you reach for first? If you are like most people, it is the bread or the potatoes, or maybe a bite of whatever is closest. I want you to try something different. Something that sounds almost too simple to be real. Eat your vegetables first, before anything else on that plate. Every single meal. Now I know what you are thinking. That is your big secret. Hear me out. When you eat vegetables first, the fiber in those vegetables forms a kind of mesh in your stomach, a physical barrier. And what that barrier does is remarkable. It dramatically slows down how fast sugar from the rest of your meal enters your bloodstream. Why does that matter for blood pressure? Because every time your blood sugar spikes sharply after a meal, your body releases a flood of insulin. And that insulin surge causes your blood vessels to constrict, to tighten. Right there at the dinner table, your pressure is going up and you have no idea it is happening. I have had patients who changed nothing else. Same food, same portions, same medications, just the order. Vegetables first, protein second, carbohydrates last. And their post-meal blood pressure readings dropped noticeably within 2 weeks. One of my patients, a retired nurse, 72 years old, called it the easiest thing I have ever done for my health. She was not wrong. So tonight, before you touch the rice or the bread, finish those greens first. Every bite counts. Now, let us talk about something that has been sitting in your pantry, possibly for years, doing nothing. Apple cider vinegar. 1 to 2 tablespoons in a glass of water with every meal. That is it. I can already hear the skepticism. And honestly, good healthy skepticism is what keeps us from falling for nonsense. So, let me show you exactly why this works. Because there is real science behind it. The active ingredient in apple cider vinegar is acetic acid. And acetic acid does 2 very important things for your blood pressure. First, it improves insulin sensitivity. Remember those post-meal blood sugar spikes that squeeze your blood vessels? Acetic acid blunts that spike. It helps your cells respond to insulin more efficiently, so your body does not have to release as much of it. Less insulin, less constriction, lower pressure. Second, and this is the part that genuinely excited me when I first read the research, acetic acid stimulates the production of nitric oxide in your blood vessel walls. Nitric oxide is your body's natural vasodilator. It tells your arteries to relax and open up. It is essentially doing what an entire class of blood pressure medications tries to do naturally for about $3 a bottle. Now, one important caution. Do not drink it straight. Always dilute it in water, at least 8 ounces. Undiluted vinegar can damage tooth enamel and irritate your esophagus. Use a straw if you can. And if you have any history of stomach ulcers or acid reflux, have a conversation with your doctor before starting this. But for most people over 60, this is one of the simplest, safest additions you can make. 1 glass with breakfast, 1 with lunch, 1 with dinner. Give it 3 weeks and check your numbers. Now, let me ask you something. Do you check your blood pressure in the morning? Most people do, but here is what almost nobody talks about. What happens to your blood pressure while you are asleep? For many people over 60, pressure does not drop the way it should during the night. It should go down. It should give your heart a rest. But in a condition called nocturnal hypertension, it stays high or it spikes while you are lying there completely unaware. Your heart is working overtime. Your arteries are under stress, and you wake up the next morning feeling tired and wondering why. Nocturnal hypertension is one of the most underdiagnosed and dangerous patterns I see. It is linked to a significantly higher risk of stroke and heart attack. And the troubling part is this. Your regular daytime readings will not catch it. You can have perfectly acceptable morning numbers and still have a serious problem happening every single night. So what do walnuts have to do with any of this? Quite a lot, actually. About 30 g, roughly 14 halves, eaten 30 minutes before bed, has been shown in multiple studies to meaningfully reduce nighttime blood pressure. And here is why. Walnuts are one of the richest plant sources of alpha-linolenic acid, a plant-based omega-3 fatty acid. They also contain melatonin and a compound called larginine. Together, these work to relax blood vessel walls, reduce vascular inflammation, and support that natural nighttime pressure drop your body is supposed to make. Think of it as a gentle signal to your cardiovascular system. It is time to rest. Stand down. 30 green 14 halves, 30 minutes before bed. Write that down. It is one of the simplest things I recommend and one of the most consistently effective. Now, I want to tell you about a flower. A deep red flower used in traditional medicine across Africa, Latin America, and the Middle East for centuries, and that modern cardiology has finally caught up with hibiscus tea. 3 cups a day. If you have never heard of hibiscus tea, you may know it by another name, sorrel carcade, or simply red tea. It has a tart cranberry-like flavor, and it is remarkably powerful. Here is the science. Hibiscus flowers contain compounds called anthocyanins and organic acids, specifically hibiscus acids. And these compounds act on your blood vessels in a way that is strikingly similar to a class of prescription medications called ACE inhibitors. You may have heard of ACE inhibitors. They are among the most commonly prescribed blood pressure drugs in the world. What they do is block an enzyme that causes your blood vessels to constrict. Hibiscus does the same thing naturally, without the cough that so many patients complain about as a side effect of the medication. A study published in the Journal of Nutrition found that drinking hibiscus tea daily reduced systolic blood pressure by an average of 7 points in adults with mildly elevated pressure. 7 points. That is clinically significant. That is the kind of result that makes doctors take notice. 3 cups a day, hot or cold. No sugar or very minimal sugar, because sugar will work against everything we are trying to do here. A small spoon of honey if you need it. That is perfectly fine. One important note, if you are already taking ACE inhibitor medication, please talk to your doctor before adding hibiscus tea regularly, because combining a natural ACE inhibitor with a pharmaceutical one can push your pressure too low. That is not the goal. We want balance, not overcorrection. But for most people, this is a beautiful, simple, genuinely pleasurable habit. A warm cup of red tea in the morning, 1 in the afternoon, 1 in the evening. Your arteries will notice. Now, I want you to walk to your kitchen after this video, open your cupboard, and look at what oils you have in there. Because what I am about to tell you might be the most important thing in this entire video. Most of the cooking oils that line supermarket shelves, canola oil, soybean oil, sunflower oil, corn oil, are extremely high in omega-6 fatty acids. Now, omega-6 is not inherently evil. Your body needs some of it. The problem is the ratio. For most of human history, people consumed roughly equal amounts of omega-3 and omega-6 fatty acids. Today, the average person consumes anywhere from 15 to 20 times more omega-6 than omega-3, 15 to 20 times. And that extreme imbalance drives something that every cardiologist dreads: chronic systemic inflammation. Remember that slow-burning inflammation in your blood vessel walls we talked about earlier? The kind that stiffens your arteries year after year. Excess omega-6 from these refined oils is one of the primary fuels feeding that fire. Every time you cook with canola or soybean oil, you are adding inflammation to your cardiovascular system. And here is what makes it worse. These oils are unstable at high heat. When you heat them to cooking temperature, they oxidize. They break down into compounds called aldehydes, which are directly toxic to blood vessel walls. You cannot see it happening. Your food does not taste any different, but the damage accumulates with every meal. So, what should you use instead? Two things: extra virgin olive oil for everything that does not require very high heat. Salad dressings, light sautéing, drizzling over vegetables. Extra virgin olive oil is rich in oleoanthol, a natural anti-inflammatory compound, and in monounsaturated fats that actively support healthy blood vessel function. Decades of research back this up without any serious debate. And for higher heat cooking, real butter. Yes, I said butter, not margarine. Margarine is made from the same problematic vegetable oils we are trying to eliminate. Real traditional butter from grass-fed cows, if you can find it, used in reasonable amounts, is a far better choice for your cardiovascular system than the refined seed oils most people are cooking with every single day. I know this goes against what many of you were told 20 or 30 years ago. The butter is bad. Use vegetable oil message was everywhere. I heard it too, but the science has moved on. And as a physician who has seen the inside of this problem for 30 years, the evidence points clearly in a different direction now. Check your cupboard tonight. If you have canola or soybean oil, you do not have to throw it away immediately. Just stop buying it when it runs out. Replace it with extra virgin olive oil. That one change alone over 3 to 6 months can make a measurable difference in your inflammatory markers and in your blood pressure. I want to stop here because something important needs to be said. You have just heard 5 things. Eat vegetables first. Apple cider vinegar with meals. Walnuts before bed. Hibiscus tea 3 times a day. Replace the wrong oils. And I can already predict what some of you are thinking right now. This sounds too simple. If it really worked, my doctor would have told me. I understand that reaction completely. But here is what 30 years of treating seniors has taught me. The most powerful interventions are almost never the most complicated ones. The body is not looking for complexity. It is looking for the right conditions to heal itself. And here is what genuinely amazes me even now. Every single one of these 5 strategies works through the same fundamental mechanism: reducing inflammation and improving blood vessel flexibility. That is it. That is the whole game. 5 different doors, all leading to the same room. The man I told you about at the beginning, the 67-year-old with the concrete arteries. After we had a long conversation about all of this, he made every change slowly, carefully in conversation with his doctor. 6 months later, he came back for his follow-up. His doctor had reduced him from 4 medications to 2. His inflammatory markers had dropped significantly. His pressure was stable, genuinely stable. For the first time in years, he looked 10 years younger. And the first thing he said to me when he walked in was this: "Why did nobody tell me this sooner?" That question stays with me. It is part of why I make videos like this one. Because the information exists, the research exists, but somewhere between the laboratory and the doctor's office and the patient sitting at their kitchen table, it gets lost. You are sitting at that kitchen table right now, and you have everything you need to start tonight. Not tomorrow, not after your next appointment, tonight. That is not a small thing. That is everything. Let me say them one more time clearly. 1. Eat your vegetables first at every meal before the bread, before the rice, before anything else. 2. 1 to 2 tablespoons of apple cider vinegar in a glass of water with each meal. 3. 30 grams of walnuts, about 14 halves, 30 minutes before you go to sleep. 4. 3 cups of hibiscus tea every day, hot or cold, minimal sugar. 5. Replace your canola and soybean oils with extra virgin olive oil and real butter. That is it. 5 things. No exotic supplements, no expensive equipment, nothing that requires a prescription. Now, here is what I want you to do right now before you close this video. Pick just one, not all five, just one that feels easiest for you tonight. Maybe it is the vegetables first. Maybe it is ordering some hibiscus tea. Maybe it is checking that oil cupboard. Just one. Start there. Because sustainable change does not come from doing everything at once and burning out in a week. It comes from one small decision repeated consistently until it becomes invisible, until it is just the way you live. I have seen this work, not in theory, in real people in their 60s and 70s and 80s who decided it was not too late to give their body better tools. It is never too late. Your blood vessels are remarkably responsive. Give them the right environment and they will respond. Which of these 5 are you going to try first? Tell me in the comments. I read every single one. And if this video helped you or someone you love, please share it. There are people in your life right now who need exactly this information and have no idea it exists. If you have not subscribed yet, please do. Every week, I bring you honest, evidence-based information that I wish every one of my patients had access to years before they needed me. Take care of your heart. It has been working for you every single minute of your life without asking for anything in return. It deserves this. I am Dr. Lisa, and I will see you in the next